Oh, hi there. You must be my new patient. Nice to meet you. My name is Dr. Birb. That's with a B at the end. Yes, like the bird. It's a little odd, I know, but it's pretty commonplace for unlondon. Yes, I know. It was quite hard to get here, wasn't it? There was a lot of guards and other people around, right? Mm-hmm, I bet. Oh, and actually, they, they put you in handcuffs too, didn't they? Oh, and they blindfolded you. Oh, good heavens. That's quite rough. Are you okay? Oh, that's good. Ah, where are my manners? Let me get the key. We'll get you out of those handcuffs right away. Let me put down my notepad first. Now, where is that darn key? Ah, there it is. And a very nice looking key it is. It must be quite a relief to finally be able to meet a good doctor, hmm? Oh, you've heard good things about me? That is good. Like what, may I ask? Oh, really? Oh, I see. These will be off in just a moment. There I go. Do your hands feel better now? I'm glad. Unfortunately, you have some bruising around your wrists, but there's nothing we can do about that, unfortunately. I apologize. Now, what is your name? Ah, nice to meet you. I'm just going to write down some notes so that I can help you better, if you don't mind. Thank you. Alright. And can I ask, when is your birthday, perhaps? Ah, I see. Okay. Oh, why do I have a plague doctor's mask? Well, you see, I am one of the residents of unlondon. I was brought here by the SCP Foundation, and I work as a doctor here as a failsafe in case the world comes to its untimely demise. I know it's quite a way of life down here, and a little unnerving, if I may say so myself, but as a SCP myself, I fit in rather well. You may recognize me from my mask and my other counterpart, the plague doctor. He is like a cousin to me. We aren't the same, him and I. He's a little more aggressive with his patients, whereas I care to help a little bit more, you could say. So I take it that you as well work for the SCP Foundation? Ah, you do. And what is your job exactly? Ah, I see, I see. I'm just writing this down for my own personal notes. And what would be your place of residence currently? Ah, I see. And which site is that again? Ah, okay. And you're here on... Oh, I see, I see. Your fourth excursion? Oh. I assume it's your first time to London, right? Yeah. As you can see, the walls of this house that we're in are not the most exciting. I do apologize. I am a little sad that they do not have more color. I do crave some colors down here in the dark sometimes. It is nice, Even plague doctors get a little in their feelings. Alright. So, why are you coming in here today? What is it that ails you? Oh, your eyes. I see. And what is it about your eyes exactly? Interesting. Interesting. Is the pain in both of them or just one? It switches sometimes? I see, I see. Okay. Do you wear glasses? No. Interesting. Does anyone in your family wear glasses? Some do. So what we can do today for you is we can conduct a very thorough eye exam for you. The Dr. Birb special eye exam, you could say. And I have to ask, because it is part of our regular lives, but have you been exposed to any SCPs recently? You have. How many would that be? Oh. Oh, I see. That's quite a lot. Well, that could be part of your problem right there. We'll get to that in a second. And you said that was how many again? Oh my. Alright, and would you mind listing those off for me? Okay. Alright. Okay. Alright. And that one, I'm not familiar with that one. Oh, I see, I see. Okay. And there's one more? Oh, okay, I see. Alright, well, that does put a little wrinkle in things, but nothing that Dr. Birb can't fix for you. Alright, let's see. I'm just taking a look at your eyes, trying to see if I see anything that pops out at me. I do see something right over here. That is quite interesting. We'll take a look at that. Oh, I see. That eye has more pain than the other one? Okay, okay. And I should have noted it already, but your eyes are... yes, blue. Very bright, I might add. Alright, I think that will do it for the notes. Alright, now, if you don't mind, I'm going to put on some gloves so that I don't contaminate anything. It's one of my pet peeves, unfortunately. Living in Unlondon for so long, I have grown quite accustomed to being around filth, and it makes me very upset. So, if you don't mind, I'm going to put on some gloves. I got these gloves especially while I was down here in Unlondon in my first few months. They're these nice leather gloves, as you can see. One day, one of the SCP officers happened to upset the bobbies. And they came out en masse to attack the officer, who was lucky enough to have backup around him. I was watching this from this room here, which has a window over in that corner, and it leads down to the street. And I saw one of the bobbies had these beautiful gloves on. And after he was on the ground and disabled, you would say, by the guards, I thought to myself, Birb, you handsome fellow, you could use those gloves. And I pondered for a second. I was like, I would quite enjoy a new pair of gloves. Leather ones at that. Leather is hard to come by down here. And so I ran down the stairs as fast as possible and grabbed these gloves right off the bobby. And before the guards could do anything, I was right back in my room, safe and sound. Quite a thrilling adventure, I know. Alright, enough of fooling around. Fits just like a glove, huh? I know. I have terrible humor. It is fine. Ignore it. Alright. If you don't mind, I'm going to get a little closer. Alright. let's take a good look at your eyes here. I see. Alright, I'm going to try to keep your eyes open and try to close them shut for me. Good. Good. Alright, now we're going to do the reverse of that. Keep your eyes closed, and I'm going to try to open them. This eye first. Good job. And we'll do this one next. Good job. Well, you have good muscle control over your eyes, I will say that. Let's take a closer look, shall we? Let me get my torch. Now I must warn you. That this light is extremely bright. And as you can hear, is made out of a very strong metal. I beg your pardon? Oh, why do I keep tapping my beak? Well, you see, as an SCP, one of my quirks, you could call it, as I have a fascination for sounds and mimicking them. I can mimic them almost perfectly once I've heard them once. So I try to make as many sound combinations as possible, and it is something that is both very pleasing and relaxing, but also something that I can benefit greatly from. Alright. Now, be warned, this might be a little bright. Alright. Let's look in the side. Okay. Okay. Look in this side. I see. Very interesting indeed. Alright, I'm just going to test your pupils a little bit. Very good. Actually, I retract that. I'm going to use the light. Alright. What I want you to do is I want you to follow the light with your eyes for me. Okay? Excellent. Well, you seem to be able to follow the light quite well, which is good. Next, what I would like you to do is tell me how many fingers I have up. I'll close my fist and then I'll raise one of my hands and tell me how many fingers are there. Alright. Yes. Mm-hmm. Very good. Excellent. Very good. Very good. Excellent. Excellent. Did quite well. My apologies. I'm just examining your eyes again. I think your problem may be work-related, but maybe not in the way you think. I'm going to take off my gloves first, and then I'm going to write some more notes down. Alright, I thought of a few more things that I would like to try. I have this thin pencil here. And I would like you to focus on it and tell me when it gets blurry, or if it does at all. Oh, I see. It was blurry up close, and then it got clearer when it was far away. Let's try it again. Same thing. I see. And how much sleep do you get per day? I know with your job it must be quite short. I see. That is quite short. People like yourself should be getting at least 6 to 7 hours a night. That is what would benefit you the most. I think your problem is you're staying awake too long, and especially under the ground here, it's hard to focus and know when the right time to go to sleep is. It's constantly dark, and we only really have this yellowish light from the lanterns that we bring down with us. I know, it's quite annoying, you could say. More of a nuisance. Alright, here is what I think we should do. I'm going to prescribe you some pills that will help alleviate your eyes. I think part of your problem is you have some very dry eyes, which is causing you to lose some focus. I also want you to stop looking at things up close for a long period of time. I want you to take a break from reading or looking at your digital screens for about 30 seconds every 20 minutes. Yes. I know you guards are watching the security cameras quite closely. Alright, let me get your medication, and then you can go off on your way. So with these, you're going to want to take one a day. You may take it with food or water. I would recommend water. And hopefully this should help. You may want to give it a few days. But after that, if it doesn't, then come back to me. Or, I should say, get one of the other guards to come find me. They'll know where I am. I guess you got kind of dragged here, and you don't really know where you are right now, do you? You'll eventually learn. This building is kept secret for my safety. My class is low enough that I am able to roam freely for the most part, but the knowledge of this room being secret is part of my containment. Alright, I will give these to you. And with that, I bid you adieu. Thank you for visiting me. It was a pleasure. And anytime, please come back.